Welcome back, guys. Now in this video, let's discuss about the topic of underwater respiration. Okay. Underwater respiration or underwater breathing. So how this is going to be different from the surface level breathing. Okay, we are all at the sea level. Okay, now we know at the sea level there is 1 atmospheric pressure or 760 mmHg. Let's say at sea level, what is the atmospheric pressure? 180 m, that is 760 millimeters of mercury. You know this. Okay, say when you ascend up, I have discussed in the high altitude physiology video. Okay, when you ascend up, what happened to the barometric pressure? Okay, what happened to the barometric pressure? The barometric pressure decreases. Okay, I have taught you that for every 5,000 meters, the atmospheric pressure is going to reduce by half. Okay, so when you ascend up, the atmospheric pressure actually decreases. Okay, the pressure which is exerted by all the gases on your body, the pressure exerted by the environment on your body actually decreases. When you ascend up, the atmospheric pressure decreases, the partial pressure of oxygen decreases. That's why you are going to get hypoxia. You know it. But what happens when you descend down into the ocean, when you dive into the ocean? 10 meters, 20 meters, 30 meters, 50 meters, 1000 meters, like 100 meters, something like that. So when you dive into the ocean is going to exert pressure on your body. Okay, imagine yourself, you are taking a dive into the ocean. So when you are going 10 meters, 20 meters, 50 meters depth, all this water column, it's going to exert the pressure on your body. It's going to exert the pressure on your lungs. So what happened to the pressure on your body? The pressure immensely increases. Okay. So what I want you to know is, if you increase the depth, what happens? There is increase in the pressure on your body. Okay. How much pressure, sir? For every 10 meters. Okay. For every 10 meters depth. Okay. Which is somewhere around 30 feet. Okay. 33 feet. For every 10 meters depth, there is increase in 1 atmospheric pressure. Okay. For example, for understanding purpose, I am telling you. See, now, see, this is the sea level. Okay. You are standing here on a boat. Imagine you are standing here on a boat. Here is the water. This is the sea. Okay. Now, how much pressure is exerted on your body because of the environment? 1 atmospheric pressure. Now, what you have done is, you have decided to take a dive into the ocean. Now, you are taking a dive into the ocean. Now, this is you. Okay. Now, because of all this water column, okay, it's going to exert the pressure on your body. Now, how much depth you went? You went 10 meters. Okay, 10 meters depth. Now, how much extra pressure is going to add on your body because of this water column? 1 atmosphere. Okay, 180. So, at 10 meters of depth, you are having 1 atmosphere because of the environment and 1 atmosphere because of this water. For every 10 meters depth, 1 atmosphere pressure is going to increase on your body. Now, here at 10 meters of depth, the pressure on your body is 280 m, 2 atmosphere. The more you dive in, the more you go into the water, the more depth you go, the more pressure will increase on your lungs. Okay. So what happens? See, you know the Boyle's law. What's the Boyle's law? Volume is inversely proportional to, pressure is inversely proportional to volume. Okay, pressure is inversely proportional to volume. When volume increases, pressure decreases. When volume decreases, pressure increases. You know it. Okay. Now, what is happening? Look, you are increasing the pressure. Okay, you are increasing the pressure on the person. When you increase the pressure, what is happening? Okay, because of this pressure, the lungs are getting compressed. Okay, lungs are getting compressed. Or I can say lung volume, that is, lung volume decreases. Okay, according to Boyle's law, when the volume decreases, what happens to the pressure of the gases inside your lung? The lungs are getting compressed. Okay, the lungs are getting compressed. You have taken the breath one time and you have taken a dive. One time you have taken the breath. There is no oxygen cylinder, nothing is with you. Okay, you have taken a breath and you have taken a dive. Okay. Now your lungs are getting compressed and already the air is in your lungs. So what happened to the pressure inside your lungs? The pressure inside your lungs increases. So that's why partial pressure of oxygen also increases. The partial pressure of carbon dioxide in your lungs also increases. They all increases. Okay, the pressure inside your lungs, overall pressure increases. So when overall pressure increases, automatically the partial pressure of oxygen, the partial pressure because of the carbon dioxide, the partial pressure because of the nitrogen, everything increases. The pressure inside your lungs increases. Okay, initially. But now imagine you are staying there, okay, at some depth. You have taken a dive. One time you have taken deep inspiration and you have taken a dive and you are staying in the depth for certain time. Now tell me what happens. What happens is, see, you are not breathing. The oxygen will be utilized by your tissues. Okay. See, initially the partial pressure of oxygen is more, but your tissues are using the oxygen. They are continuously utilizing the oxygen. So gradually the partial pressure of oxygen, okay, the partial pressure of oxygen will decrease. Okay, and the tissues are producing carbon dioxide. As your tissues are producing carbon dioxide, the pCO2 levels in your body increase. So there is hypoxemia in your body. The partial pressure of oxygen is decreased, which means hypoxemia. Okay, later that will cause hypoxia. Okay, hypoxemia. And there is hypercapnia. So hypoxemia and hypercapnia are there. You know the peripheral chemoreceptors which are there in your blood vessels, like a carotid body and aortic center. The peripheral chemoreceptors are going to get activated because of this hypoxia and hypercapnia. Okay, because of this hypoxemia and hypercapnia, what they will do? They will activate the peripheral chemoreceptors. Okay, peripheral chemoreceptors. Now you tell me, when the peripheral chemoreceptors are activated, you know the peripheral chemoreceptors are going to trigger the respiratory centers. So you will try to do the hyperventilation. So immediately what you will do? You are in the ocean, you can't take the air. So immediately you will try to ascend up to get the air because there is hypoxemia developed, there is hypercapnia. So your respiratory centers are so much stimulated. So you want to take the inspiration. So immediately what you will do? You will ascend up and you will take the breathing, heavy breathing. You will do the heavy breathing. Okay. So this is what happens when you take a dive. But see here, when you want to stay in the depths for longer duration, okay, where you want to do some expedition, you want to do some research under the sea floor, so you have to stay in the depths for longer time. So what you have to do? You have to carry certain apparatus with you. You know, the scuba equipment. So what is this scuba equipment will try to do? Let me tell you. Stay for longer period in underwater. Okay, what it takes to stay under the water. Okay, what do you require? See, one thing. Okay, for example, let's say you are taking a dive. How much dive? You are taking a dive to 100 meters, let's say 100 feet. Okay, 100 feet. When you take a dive to 100 feet, what happens to you? The atmosphere, the pressure, not the atmospheric pressure, the pressure on your body will increase. The more the depth, the more the pressure. So the pressure increases to 4 atmospheres. Okay, the pressure is increasing to 4 to 5 atmosphere. Okay, pressure is increasing. Okay, now see, whenever there is so much pressure on your body, you can't breathe, your lungs will be collapsed. But what you have to do? You have to stay under the water. So now imagine this is your lung. Let's say here is your lung. Let's say one lung. Okay. Now from outside there is 4 atmospheres of pressure. It is trying to compress your lung. So to prevent this collapse, what you have to do? You have to create the opposite force here. With the same pressure, you have to give the opposite, you have to apply the opposite pressure so the lungs will not be collapsed. So you have to create how much pressure here? 4 atmosphere. Okay, so how you are going to do that is via the Scuba apparatus. So you know the Scuba apparatus. Now, do you know what happens with the Scuba apparatus? See here, you are having a cylinder outside the body. What is there? There is a cylinder. This cylinder is going to contain all the gases like nitrogen, oxygen. Okay, initially there is nitrogen, carbon dioxide, oxygen, everything is there. All the gases are there. Now here the pressure is maintained. How much? 550 atmospheres of pressure is maintained. So much pressure is there. Okay, 550 atmospheric pressure. Now, so there is a valve. We don't require 150 atmospheric pressure. So there will be a valve according to the outside pressure. For example, if it is outside 4 atmosphere, with the same amount of pressure, the gases will be released into your mouth. You are going to take it to your mouth, not directly to your lungs. You are going to say from the cylinder. There will be a valve. Okay, there is a regulatory valve. It reduces the pressure according to the outside pressure. So you are going to have it to your mouth. Okay, you are going to have it to your mouth. So you are going to take a pressure of how much? 4 atmosphere. With the 4 atmospheric pressure, the gases are going into your lungs. Outside also 4 atmosphere. So do you think the lungs will be collapsed? No, lungs will not be collapsed. Okay, now the lungs are not going to be collapsed because how much you are taking? You are taking with the pressure of 4 atmosphere. Okay, so inside 4 atmosphere, outside 4 atmospheres, now the lungs are not going to be collapsed. Okay, but the problem is, you have increased the pressure. Okay, you have increased the pressure. Okay, so normally in your lungs, for example, at the sea level, talking at the sea level. Now, what is the pressure? 1 atmosphere. Okay, the partial pressure of oxygen, you know, the partial pressure of carbon dioxide, they are at a normal value. Okay, but what you have did now, you have increased the pressure. Okay, when you increase the pressure, automatically the partial pressure of gases in your lungs, also increases. The partial pressure of oxygen increases, partial pressure of carbon dioxide, partial pressure of nitrogen, they all increase. So with the high pressure, you are taking this oxygen, carbon dioxide and nitrogen. That's something bad. That may cause bad to your body. Of course, to prevent the collapse of the lungs, you are creating higher pressures inside your lung. When you are creating higher pressure inside your lungs, automatically the partial pressure, say the overall pressure is because of partial pressure of oxygen, carbon dioxide, nitrogen, all this together contributes to the pressure. So when you increase the pressure here in your lungs, automatically the partial pressure of oxygen will be more, carbon dioxide, nitrogen, everything increases. This creates a problem. When more oxygen is there in your body, means when the partial pressure of oxygen is there, more. Okay, oxygen is not a good thing. Because oxygen, of course, it is going to helpful in the production of ATP. We require oxygen. But excess oxygen is dangerous. This excess oxygen, if there is more partial pressure of oxygen, means more oxygen will be going into your body. You know, gases will move from high partial pressure to low partial pressure. Now in your lungs, there is high partial pressure of oxygen because of the Scuba apparatus. High partial pressure of oxygen is there in your lungs. Now, when more partial pressure of oxygen is there in your lungs, means more oxygen will be delivered to your tissues, more oxygen is coming into your capillaries from there to the tissues. So this more oxygen will cause oxygen toxicity. Okay, what is this oxygen toxicity? This oxygen, this extra oxygen, whatever is coming into your body, it forms a free radicals. Okay, it forms a free radical. These free radicals, what they will do? They will cause lipid peroxidation. Okay, wherever there are lipids, the lipids will be undergoing peroxidation that will cause the cell damage, cell injury. Because lipids are present everywhere. Your cells are made up of phospholipids. Cell membranes will be damaged. Okay, the blood vessels will be damaged. The neurons will be damaged. The myelin sheath will be damaged. So it's going to cause a lot of fussiness in the body. Okay, so oxygen toxicity, same. When carbon dioxide level increases, you know, carbon dioxide is a source of acid. So this carbon dioxide is going to cause acidosis in the body. So deep sea diving, tell me, deep sea diving, okay, causes acidosis. When you ascend up high altitude, okay, high altitude breathing, I have told you there will be alkalosis, respiratory alkalosis. But you go deep down, there will be acidosis. Because the partial pressure of carbon dioxide is more. That's going to cause acidosis. Okay. Next, because of the high pressure of the carbon dioxide, it even causes respiratory depression. respiratory depression. Okay, so high levels of normal increase in the levels of carbon dioxide, little increase in carbon dioxide is going to cause the stimulation of the peripheral chemoreceptors that increases the breathing, that causes the hyperventilation. But now the partial pressure of carbon dioxide is so much for so long time that causes the respiratory depression. Initially it may increase the respiratory activity, but later it decreases the respiratory activity. Respiratory depression can be seen. Now if the partial pressure of nitrogen is more, that's going to cause the nitrogen toxicity, where the patient will have this nitrogen, this high levels of nitrogen. What it will do is it's going to cause depression. Okay, in the nerve conduction, the nerve conduction will be decreased. Okay, the nerve conduction will be decreased. That actually causes a depression like condition in the patient. This is called as nitrogen narcosis. So what it is called as? It's called as nitrogen narcosis, also called as Martinez effect. So what will be seen? Okay, what will be seen in a patient who have taken a deep dive into the ocean with a scuba operator? The scuba operator is going to be helpful for you, but long term. Okay, if you are staying there for long duration, say from the scuba apparatus, the gases you are getting with the high partial pressure, so more oxygen will be going to your body, more carbon dioxide, more nitrogen going to your body. They will cause nitrogen toxicity, carbon dioxide toxicity, and nitrogen toxicity. The nitrogen toxicity is a more bad thing. It causes a depression kind of effect. It affects the nerve conductance. So this is called as narcosis or Martinez effect. Actually, the patient will feel like just he's on alcohol. Okay, so that's why we use the word narcosis. Okay, next, so some other problems with the deep sea diving is when the person is trying to come up. Okay, diving completed, research completed. When he tries to come up, okay, from 100 feet, he have to come up slowly. Okay, he should not come up rapidly. There shouldn't be rapid ascent. He should come slowly. Why? Because when he comes up fastly, there is a rapid decrease in the pressure. Okay, he have to come slowly. For example, let's say fast ascent. There is fast ascent. Whenever he is coming fastly up, the pressure decreased rapidly. Okay, pressure is decreasing on the body very rapidly. So there is a decompression. Okay, rapid decompression. So now do you know what happens when you suddenly decreases the pressure? Now you know that in the Coke bottle, imagine yourself having a Coke bottle. Okay, see, when you just shake it, okay, when you just shake it, you know the pressure inside the bottle increases. Okay, because of the the pressure inside the bottle increases. When you suddenly open it, what happens? Bubbles will come. Okay, with lot of force, the Coke is going to come out of the bottle with a lot of bubbles will be seen. So what I'm trying to put into your mind is when you suddenly decrease the pressure, okay, the gases will form the bubbles. Not only oxygen, nitrogen, carbon dioxide, they will form the bubbles, especially the nitrogen, because nitrogen bubbles will be more because nitrogen is the major component. Okay, 79% of the environment is the nitrogen. So nitrogen will form the bubbles. So rapid decompression is going to form bubbles. Okay, which bubbles? Mainly nitrogen bubbles. Not only nitrogen bubbles, of course, carbon dioxide bubbles will be seen, but the major bubble here is the nitrogen. Nitrogen will form the bubbles. The problem with these bubbles, what is the problem with these bubbles? Bubbles are bubbly, they are looking good. So something bad with the bubbles? Yes, these bubbles, they will block the blood vessels. If the blood vessels are blocked, for example, the blood vessels going to the bones, if they are blocked, that's going to cause a bone pain. Okay, that's going to cause severe bone pain. If the vessels which are going to the muscles, if they are blocked, that's going to cause muscle cramps. So this fellow who have ascended up very fastly from such depths, immediately he is going to feel pain. So pains and muscle cramps. Okay, because of this pains, because of the pain in the body, he is going to just flex his body. Okay, he's going to just flex his body. He's going to just, like, becoming like a baby because of this pains. He can't tolerate the pain. That's why this is called as bends. Okay, so the disease of rapid decompression. Okay, rapid decompression sickness. The patient is going to flex his body entirely, so he's totally bending. Okay, and these bubbles, if they block, okay, these bubbles, okay, these nitrogen bubbles, if they block the vasculature of the lungs, okay, if they block the vasculature of the lungs, that's going to cause respiratory difficulty. Now the patient is choking, he cannot breathe, he chokes. So that's why this disease is called as bends and chokes. Okay, rapid decompression can lead to bends and chokes. Okay, so these are the points which I want you to know. Okay, these are the points which I want you to know. So there shouldn't be fast ascent, there should be slow ascent. Time, they should come up gradually. If they do the fast ascent, okay, if they are not following the protocols, and if they do the fast ascent, that's going to cause a rapid decompression, a sickness, where the gases are going to bubble, form the bubbles, and they are going to block the blood vessels, and that's going to cause chokes and bends. Okay. Next, how to prevent this? How to prevent this? First of all, they should come slowly, and the dangerous gas here, I have told you, it's a nitrogen. So better not to use the nitrogen. Don't use the nitrogen. Okay. So instead of nitrogen, you have to keep some other gas. You can't change the composition, like, you can't keep only oxygen. So instead of nitrogen, you can use helium. So helium replaces which gas? Nitrogen. So helium is going to replace the nitrogen, because helium is going to form the less bubbles. Helium is going to dissolve into the blood less. Helium will cause the less narcosis. Okay. So helium is a better agent. Okay. Now you are going to use the helium along with the oxygen in the cylinder. Helium, oxygen. So this mixture is called as heliox. Okay. This mixture is called as what? Heliox. What is heliox? You have replaced the nitrogen with the helium, because helium is a better gas when compared to the nitrogen. So the narcosis, okay, nitrogen narcosis, nitrogen, if you use the nitrogen is going to cause the toxicity, that's going to cause the depression, okay, that will cause the conduction problems in the nerves, it. So that will be less with the helium, that effects will be less with the helium, so less narcosis. Okay, less narcosis will be seen, and less bubble formation. Okay, even the dissolving, okay, dissolving of helium will be less. So helium will be less dissolved when compared to nitrogen. If it is less dissolved, less bubble formation. So helium is a better gas which I want you to know for your exam, and helium is a lighter gas. Okay, so it will be easy for you to take inspiration and expiration. Helium is a lighter gas when compared to the nitrogen, so it will be easy for you to do the inspiration and expiration also. So these are the points which I want you to know for your exam. Okay, it's a very small topic, underwater breathing. Hope this video is going to be helpful for your exam. Thank you.